Thanks again, Jim and Quanta, for inviting me along. When you've got your own business, it's always good to get a free junkie. You don't get many, do you, when you've got your own business? So here I am. I apologise to anybody that's seen this presentation in the past. There's been a few updates made to it, but it's basically the same content. So for any new viewers, that's great. My name's Darren. I'm from Vanishing Ink in Sydney. We opened about 5 years ago. I bought my first Quanta laser a bit longer ago, 5.5 years ago, and it was a Q plus C standard tattoo removal laser, so it's the nanosecond laser. It doesn't have a fractional handpiece. There's a fractional handpiece that comes in the new Evo version of the Q plus C, which is not to be confused with the fractional laser in the U laser that I'll also talk about in a minute. So I've got the 3 wavelength Q plus C, which is a 1064, 532 and the 694 Ruby laser compared in a nano machine combined. And we just specialise really in tattoo removal. Having said that though, I am about to talk about our experience in using the Q-switch laser in combination with the U laser, and we've also got some other opportunities. We're very fortunate that we work on the same floor as a plastic surgeon who was very interested in using or selling some of the services of our fractional laser for skin rejuvenation and resurfacing purposes and scar revision purposes. So it's nice to be able to have other income streams coming in. So as far as our business is concerned, Vanishing Ink, all we do is treat tattoos, but we also earn some revenue out of using the laser for other purposes. Now those other purposes are more in line with the presentation that Tanya's going to do later on. She will talk about it from an aesthetic, cosmetic perspective, but it's very effective for those things. I'll just throw that in. So yes, look, that's the machine I've got. Very important if you're considering tattoo removal. If you're going to be serious about it, you need to have 3 wavelengths. It's very important to have the 3rd wavelength being the Ruby, because there are lots of tattoos with blues and greens and increasingly these days, and you can't get them out with just a 1064 and a 532. Even some of the brands of the Pico lasers that are around these days that simply have 1064 and 532, they still won't get the greens and blues out. You need a Ruby laser. Look, I won't go into all the text too much. I mean, everybody knows what the details are, and the latest version, the Evolution version, has got slightly better specs than that. There's a bigger spot size. It's got a combined fractional handpiece, so you can get some of the benefits that I will talk about in how I use the U laser from the new Evo laser. The fractional laser that we use, the MT mixed technology that Salo introduced to you a few moments ago, I was first introduced to this at a conference like this a few years ago when Dr. Sabano from Italy was showing how he'd used this laser in combination with his Q-switch laser in order to remove some problematic tattoos. So I picked up on that and I use it for all of my treatments now. I do a combined approach on both of these lasers. In a nutshell, as Salo discussed or described earlier, generally when you're talking about fractional lasers, most of the brands out there are either a CO2 fractional laser or an erbium fractional laser. This is a nice combination of the both. They're very tunable. You can dial up one or both of the wavelengths. You can use them in whatever combination is appropriate for the condition that you're treating. So we've developed tattoo treatment regimes that we save to the database and dial up each time. Basically, we perform our treatment with the Q-switch laser first on any of the tattoos that we treat, just like we would without the fractional laser. And at the end of the treatment, we run over the top of the tattoo with the fractional laser. Now, the fractional laser, especially in comparison to a Q-switch laser, is very, very unpainful. It's very uneventful on the skin, and most people, by the time you finish with the Q-switch laser, don't know you're even firing on the skin. So it's not a pain issue, and it's very quick. We tend to treat, depending on the style of tattoo, if it's just a small tattoo and you can treat the whole tattoo with the fractional laser at the end, that's great, and that's what we do in 95% of circumstances. In the event that we're treating a very large area and it's not pragmatic to treat the whole area with the fractional laser at the end, then we might run over the darkest spots or the spots that have got the non-black colours in them, because they're the colours that are more likely to cause blisters, and one of the primary benefits of using this laser is preventing blisters and improving the healing outcome, which I'll talk about in a minute. So basically at the end of the treatment, we run over this, the tattoo area that we've treated with a fractional laser, and we create lots of tiny little holes in the surface of the skin that lets the heat out from the frosting and from the treatment that's been performed with the Q-switch laser. And nothing else really changes with regard to the aftercare. Everything else is the same from the client's perspective. Why do we do it? The main reasons, as I mentioned earlier, by creating those little holes in the surface of the skin effectively, it lets the heat discharge more quickly. So from a comfort perspective, the feeling of the tattoo afterwards is improved in a quicker way. So not only is it a shorter painful period after the event, but it's also a quicker recovery in terms of how quickly the skin recovers. So bear in mind that this laser is used primarily for skin revisions, scar revision, collagen remodelling and stimulation. So when you've got a tattoo treatment going on and you can then run over the top of it with a treatment that stimulates the collagen and helps the healing, then we're just really making sure that we leave the skin in a really perfect state. Some of the other things some of the other benefits that we've observed, it does hasten the normalisation of pigmentation. So sometimes if you're using particularly the non-1064 wavelengths, and depending on the type of skin you're using them from, there may be some temporal hypopigmentation experiences, and by using the fractional laser on the skin after using those colours, it does speed up the removal of the normalisation of the pigmentation process between treatments and at the end of treatments. Importantly, it fixes damage that we've observed in people from other clinics. So people have been along to other clinics that have cheap, dodgy lasers or bad operators, and they come in and they're scarred and their tattoos are damaged, and so we can quite often, not all the time, but we can, depending on how much damage is done, we can quite often reverse some of the ravages of the poor operators before being able to completely finish the removal for them and leave their skin in a better condition than we found it. And it does speed up the removal process. I can't tell you what the percentage is. I haven't got a scientifically enough approach to be able to tell you exactly that it increases it by 15, 20, 30%. But it certainly does speed up the removal. We've noticed that the number of treatments that we're now treating on most tattoos is probably 1 or 2 less than it would have been if we weren't using the fractional laser at the end of the process. Yes. No, absolutely not. It doesn't speed up the time you need to leave between treatments, because it's not speeding up the rate at which your body removes the fractured ink particles. It's more helping the local healing going on that's on that part of the body. There's just some examples of some of the benefits. This is an example of a multicoloured shoulder tattoo, so it's fairly large. And we used all 3 wavelengths on this tattoo example when we treated this guy. And quite often when you're using 3 wavelengths, and particularly when all of the colours are mixed and adjacent to each other like we have in that example there, and because of the size of the tattoo and the placement of the tattoo, it would be slightly more prone to developing blisters the next day than if we hadn't run over the top of it with the fractional laser. So this is an example. The slide in the centre there is the next day. We treated the guy. The next day he didn't have any blistering at all. He was very good with his aftercare. He went home and he put his ice packs on and he did what we asked him to do. But you can see for people that have operated the laser before will see that we'll know that those colours are quite susceptible to blistering on a large tattoo like that. So that was good. This guy only wanted 2 treatments. He was fortunate enough, he was kind enough to drop in and give us a photo before he got the cover-up done. So we had 2 treatments for the combination of our 2 lasers, and he was happy to go and get a new piece over the top. Once again, I included this example because we had, not only did we use 3 wavelengths on it, but it's on a part of the body that's notorious for blistering because of the lack of circulation that your lower limbs experience. And this was the very next day. Previously, before I had my fractional laser, I had treated this lady and she couldn't run for a week. But this was the next day. She went home, she did the right thing. She elevated the leg and stuck an ice pack on it, and she was much happier. She could resume running much quicker than she could without the use of the fractional laser. Look, this is just another example of multiple wavelength treatment one day and then the next day. Once again, this is on the lower wrist, forearm coming down to towards the wrist. And once again, people that have treated tattoos before know that a tattoo like this with lots of shading in it, the ink from the shading mobilises very quickly into your bloodstream. You usually get a lot of swelling associated with it. And in this case, the very next day, there was no blistering. He had a good experience with it. Oh, this is just a little bit of an example. This guy had had various treatments. He came to us from another clinic. We performed a couple of last treatments on him. The AL initials there, there really wasn't any ink left in it by that point. It was really just a little bit of scarring that had been put there either from the creation of the tattoo or the first clinic he went to. So we simply gave it one treatment with our fractional laser, and after 2 months it improved significantly such that we didn't have to do any more. So that's just a nice way to be able to help people out when they come in and they think they've still got ink in their tattoo, and quite often they don't have ink in their tattoo. It's just the pigmentation in their skin that's been altered by some of the processes that they've done to it. That's just another example. We'd taken this guy's tattoo off. He had a little bit of hyperpigmentation, which probably would have resolved given time. So we gave it 2 treatments and with the fractional laser, and when he called in 8 months later, that's what it looked like. It's a bit hard to see on this that after a few Q switch treatments, there was a little bit of hypopigmentation on this lady's arm, and it's exacerbated by the fact that she's got a tan in the centre photograph. But after one treatment with the fractional laser and a bit more time, it cleared up nicely. You may have seen people that do this already. You may have already seen there used to be. There's not so many of these practices around anymore. There was an old removal technique where people used to tattoo a magnesium paste back into the tattoo to try and remove it, which was somewhat effective, but it always created scars. And the more treatment you have, the bigger the scar and the more likely it was to scar. So we get a few people coming in that have had a couple of treatments and realised that the ink's really not resolving very much, but the scarring is increasing. So it's good to be able to have a fractional laser. We've given this lady 4 treatments with the combination of our 2 lasers now, but not only in this case, that paste methodology that she'd applied had in fact created a lot of scarring over the top of some ink that was trapped down underneath it. So otherwise it probably wouldn't have taken 4 treatments to get it where it is. I think there's probably 1 left in it, but we've been using significant scar revision settings, unlike the settings that we would normally use on somebody after treating their tattoo. We've been using the more appropriate scar revision settings to really break down and flatten out some of the scarring that's there from the paste method. That's another example. This guy had various treatments with the paste, and even though there's a little bit of there's a bit of hypo left in here, it's certainly getting out the rest of that ink and helping to flatten out the scar. This is a guy that came to Filipino skin, this guy, and he'd been treated somewhere that had left him quite hypo and hyperpigmented, and it was hard to tell whether there was much ink in there, so we gave him 5 treatments with our fractional laser over about a 12-month period, and that's a much better result than what he had before. This is just a similar method, not quite the paste method, but you may have seen the tattoo away method where they effectively drill little holes down into the skin and take the tattoo away one drill hole at a time. Once again, people tend to pick the scabs off, and it creates scarring and creates the same challenges as we see with the paste method. And once again, we gave this lady 3 combination treatments. There's probably 1 left in it, but it's not only significantly removed most of the ink, but also flattened the scar out. Yeah, this was an example of a lady that had been treated somewhere else many, many times with a 1064 laser, which wasn't treating the purpley blue colour that was in her arm, and we gave it 1 treatment with our ruby laser and a combination treatment, and she hasn't been back. That was sufficient to get rid of her. Look, this assisting in removal, I mean, there's all many different strains of how hard or how easy some tattoos are to remove. This was just one of the first examples. Look, I think when I first put this slideshow together, of someone that we treated the most with combination of both lasers, and yeah, look, there's not much to go in there. I think she might be done now. Oh look, these are just more examples of combination treatments, and this is another good one because we'd already given this lady 6 treatments with our Q-switch laser before we got the U laser, and now for the last 2 we've given her combination treatments, and this is a good result because there's lots of, I mean, we're not finished yet, there's still a bit to go, but these colours in here are quite challenging, and there's a big, on this white line here, there's a big scar right through the centre of her wrist, which you can sort of see in this mark over here, and all of these little residual pieces of ink are effectively the oxidised ink that's resulted from some of the whites that we used and mixed into the lighter colours over on the fish. So we're now just, that's the last ink that's coming out. All the bright colours have come out nicely. One of the good things about having the fractional laser is that I can confidently use a much higher setting, particularly when it comes to the 532 wavelength, which generates a lot more heat in the skin. I can use a much greater setting and get a much greater benefit on the really light colours when I know that I can run over the top of it at the end with a fractional laser and prevent it from blistering. Because otherwise, when you're using such high settings, it's almost inevitable, regardless of your best efforts and the customer's best aftercare, to prevent blisters in some of those cases. They're just more examples, really. Any questions? Anyone got any? No. As I said, the fractional laser, we use it primarily. We use it for all of our tattoo removal clients, and if Tanya doesn't make it tonight to show you what she uses it for in the aesthetic side of things, that'd be a shame. But she also uses it. When I spoke to Tanya last, she was also using it in their tattoo removal uses as well. So after they use their Q-switch, they're also using it now to run over the tattoo at the end. So it's a very versatile machine. If you're in the situation where you can offer more than one service, it's certainly beneficial. It's certainly beneficial for tattoo removal, but if you can also offer it other services offered to earn more revenue, then it's...
So in your experience, it's the best way to go, have both of them, is it?
It is. Look, in my experience,
yeah.
I think it makes such a difference to clients that I had, particularly with large tattoos. The larger the tattoo,
Yeah.
the more beneficial it is by having the fractional impact.
More area with less trauma.
Absolutely.
Yeah.
And the heat just gets out so much quicker.
Yeah, because you do that at the end, yeah?
Absolutely.
Yeah. Yeah.
And
it
the good...
relieves it.
It does, and effectively, so what happens is, instead of, and quite often if you're treating a large area, like if you're doing the outer part of a sleeve or something,
yeah.
by the time you've got to the end of the treatment, and you've had ice packs on the top half of the arm for half an hour while you finish the rest of that treatment, then you run over the top with the fractional laser at the end.
Yeah.
Some of those parts at the top that you treated earliest are already starting to get inflammation, and instead of starting to form blisters, you can see it's a little bit more oozy.
Yeah.
So it's a much better reaction than starting to get blisters and risking damage to the skin through blisters.
No big build up.
No, not at all. Sometimes if you did someone with a half sleeve or a significant amount,
yeah.
you might get the occasional little sort of rice bubble size blister, which in most cases will just reabsorb and go back down if they treat them the right way.
Yeah.
So for people that have been treated with and without this laser, they swear by it. They think it's fantastic.
Yeah.
Yes. So the new Q Plus C Evo has a fractional handpiece in it. So and it fires the fractional laser based off those 3 wavelengths that are in it. Okay.